Hi, everybody. It's Dr. Dave. Happy voting day. Hope you went out and voted. I was reflecting today on what made me go into pediatrics in the first place. And this was prompted by the fact that somebody had mentioned to me recently, wow, I don't think I could do that. It seems so hard. I don't know if I could see children be sick all the time. And yes, it is true that kids get sick, that it is heartbreaking at times. But first of all, most kids' illnesses are minor. Unlike adults, they haven't smoked for 50 years or uh, drank 700 gallons of alcohol or whatever negative health behaviors that most adults have achieved by the time they're later in life. Um, which means that disease is occurring on a much healthier body. But I think for me, there were a lot of things about pediatrics that drew me in. First of all, even though kids do get sick and it can be tragic, they usually get better. And so that makes the specialty a very happy one. And in general, even when kids get sick, they're maybe cranky or fussy, but they're in much better spirits than the average adult, I find. And the degree of relief that I can provide to parents, because one of the major things I tell residents and students when I'm training is that parents just want to know that their child's going to be okay. And if you can give adequate reassurance to that effect, if you can educate and give them things that they can do at home, tell them things about what to expect so that they know what they're looking for when they go out the door, so they can answer the question, okay, if this isn't dangerous right now, how will I know when it is? If you can answer all of those questions, you've really done a very good job. I used to have a sign on my dresser that said, "The art of medicine is amusing the patient while nature takes its course." And this tends to be exceedingly true for parents because most illnesses get better. Children are very vulnerable to a lot of viral illnesses, but the vast majority come and go. And even though the child will get sluggish and fussy and things like that, they'll get through it. On the other hand, the parents, their anxiety level may get to the point where they might not. And for a pediatrician, it's sort of walking the whole family through those moments, and that really attracted me to pediatrics. When more serious illness occurs, it's occurring at a time of growth and development, and being able to intervene and stop those processes before they significantly impact lifelong health. That also was something that attracted me to this discipline. And I like the fact that there's a lot of detective work that I have to do. My physical exam skills have to be very good. My ability to interview parents has to be very good because the child typically can't tell me exactly what's wrong. And of course, as the child gets older, they get more accurate, but especially with younger children, they tend to report their symptoms according to things they've heard people say, not necessarily because that's what's actually happening. And so being able to root through all of that information, being able to address the parents' concerns adequately, being able to understand what the child means versus what they say, all of those things make pediatrics challenging. It's not challenging in the same way that adult medicine is, where you have multiple problems going on simultaneously. But I think that really, instead of being a tragic or sad specialty, pediatrics is very happy. The children tend to get better, even in the worst case scenarios. The parents just really want to help their child get better. And I have an opportunity to impact lifelong health behaviors both through well care and through intervening in sick care before it affects their growth and development. So all of those things really made this a great specialty for me, and I've loved every minute of doing it. And especially, I would love being able to help you and your child. So please check out solutionpediatrics.com. Book an appointment if you have a concern. Cost is no more than an office copay, and certainly it's a lot better than getting out in the middle of the night trying to haul your child into an emergency department or urgent care and paying those rates. Like I said, I hope you got out today, and I hope you have a wonderful day. We'll see you later.